birds. I just have bird TV on right now for the cat. So if you hear birds chirping in the background, it's just cat TV. How's everybody doing? I see we got 8 in so far. I had a lot of questions the last 4 hours about lab and path, so I thought I'd show you my section real quick before we get into. We had at least 4 pass this weekend. Their CPC exam, so we've probably had a dozen in December. Tiki-Talk went to, it disappeared on me for a second. So hopefully I didn't lose everybody. But what I was saying is we've probably had 12 of us so far from the last 30 days pass. So it's been really exciting from Jess passing. She was the one that had the 6-100. Why I'm going in and out, guys. Hey, guys. I'm just sitting here kind of holding the phone going, please don't boot me out again. I keep getting booted out. I hope y'all can hear me. We've had so many pass recently. I was just bragging about how many have passed recently, and was so excited about that. You took it Saturday. It was exam B. Good. And I have showed Miss Howard how what was on exam B. So I hope you were part of those lives where I showed what was recently on exam B. I have some new updates of what were on the exams from this weekend. So hopefully that will help somebody else too. Let me see if I can't get this back up in here. Oh, good. You bought it off of Etsy. Good. Those proceeds will go to help somebody else and give them a free section. So that's awesome. Were you the one that was in chat that was saying the anatomy was word for word what was on the exam is what I had on the exam B posted up on Etsy? There was lots of notes that were useful on my test. Great. That's so good to hear. I remember being disillusioned when I was out there buying information that I thought was going to be helpful, and it wasn't. And it was really unhelpful for the exam. Really unhelpful. So that's exactly what I do not want to be. If you are in a crunch and you just now found me and you're taking your exam in 2 days, you don't have time to stick with me for 2 months for me to show you how to do all this for free, which I'm happy to do, and you just need something quick. That's why Etsy's there. That's great. I don't want to sell anybody any information that is not helpful, because I've been in that shoe before, and that's the worst thing ever, especially when I know certain people have been doing this for a decade. I've only been sharing information since April, and I want to be helpful. And I think I'm more helpful than some people that have been out there longer. So that's super nice to know. I don't want to be just selling stuff. And the proceeds to that definitely goes to help somebody else. If anybody is looking for me, I'm going to bring this up. Had a crazy afternoon. I can't find my vaccine card, and I'm going to need it because I got my husband's Christmas present. He's not home, but hopefully he's not joined on the live. But he's going to get to go see his favorite football team the day after Christmas play. Well, they won't let you in this specific stadium without your vaccine card, and I got to find my vaccine card. Oh my gosh. So I lost that, and then my kid comes home from school, and he lost his school-issued laptop. So it's like we have the black hole in our house. It's oh, so stressful of an afternoon. So I'm a little crazy right now. But if anybody is looking for me and looking to know where my information is at, if you want to know how to prep your book for free with screenshots of what the sections should look like, what you should box, what you should highlight, what you should add to the anatomy and stuff, that's available on my website. It's free. Medical Coding by Jen. You can even go to that website and just scroll halfway down, and there's a free 10 question E&M exam on the middle of the page that you don't even have to join the website and look for. But once you get in there, there's 2 programs. 1 through 3 steps is on one program. 4th program, or the 2nd program, has the 4th step of how to prep the CPT book. 90 of your questions are in the CPT book of your 150 that you need done for the CPC exam. So this book is pretty vital. You're using this book 3/4 of the time, looking for answers. So that's helpful there. There's also, you can sign up for tutoring there, and I keep setting up the site wrong, so I apologize if you've looked at the site and it's been a little weird, like you can't schedule tutoring till 2 days before. Well, I meant to give me 2 days till you can do tutoring. Like, don't schedule it today if you want to have tutoring today, because I need to prep for it and get what you want. Hold on, I need to yell at my kid for just a second. He's supposed to be doing... Turn that on while I'm doing my live. That distracts me, okay? Ooh, he's supposed to be folding towels, and I'm hearing helicopters fly through the house. So I had to go yell at him. And I had to knock his helicopter out of the sky, and he's like, Mom! Okay, so tutoring is there. I think I finally figured out which buttons to push to sign that, to get that sign up correct, so you can book out farther than the way I had it set up. The tutoring is $26.99 an hour, and I have open more days right now until the end of the year. And it's super helpful. Let me tell you, it's really helpful. If you have like 3 sections you want to go over that you are low in and you have no idea what's going on in them, and you want to prep for the CPC exam, that's what that hour is for. It's super helpful to go through that and have that done. I do not let it be useless. And if I feel like I haven't given you enough information in that time, I'll reschedule for another hour on my dime. And we'll do 2 sessions if I need to, if you just weren't getting it. YouTube, if TikTok records this live, I will definitely be posting it on my YouTube. They have only done 1 out of 20 the last month, so unfortunately they're not as prevalent on YouTube as they were. TikTok has been updating their site and moving stuff from servers to servers, and they're having issues recording everybody's lives. But it's Coding by Jen, and I do have a bunch of old lives there. They're 2 hours long, just like tonight. TikTok, y'all know where I'm at here. Messenger is my other very vital part of what we do. I have a messenger group of 100 and some odd people, and we discuss everything about the CPC exam. And when I'm not so crazy busy, of course, I send out query questions, and people ask, why is the answer this way? And then I answer them when I'm not so busy. I got to still answer this one today. But we work really hard on all this and share a lot of information that is true and honest and downright helpful. Let me tell you, you can join that messenger group by following me and finding me on Jen Brewer. Don't find me on my other thing that says Coding by Jen, because that one I can't add people to our chat for some reason from that location. I don't know why. It's something about Instagram is messing with Messenger, and it won't let me do that. So you have to find me on my personal account, which is fine. It's under Jen Brewer. So just find me there, and then I will add you to our chat group if you want to, or you can even message me there. I'm quicker there than I am on email, but I do get to emails because this pops up easier, and it's easier to reply and hit send for some reason than an email is. So just find me there if you want a private questions or if you want to join our messenger group. Of course, I do have email. If you go to TikTok and you click on my face after the end of the live, you'll come to the profile pic that tells you who I am. There is an email link right there if you want to email me. It's just codingbyjen@gmail.com. You can also click the link right there, the black long link, and that'll take you to the Etsy store, which, like I said, if you're in a rush and you need a copy of this book page by page or a section of it, those sections are posted up here. Everything's 10% off right now, and then if you click that link, it'll add another 20% so that you're 30% off of whatever you need. If you need bigger coupons, let me know by messaging me on one of those sites and let me know. But I'm here to help you. I'm not here to sell, but I'm here to share information for sure. But there does come a point in time where it does take a lot of time away from me and the family, and this does help out with keeping me a little motivated to be sure and update these and get this information out to you and go through the work of scanning each page and updating every CPT code for you and getting it posted for you. It helps out because I do work full-time in the medical field. I'm a medical auditor, but then my downtime, I work on this for you guys. So that does help a little bit. But I wanted to go over lab and let y'all know a few things in lab and path because this is a very hard section. And my one point here is it is harder to get lab and path than the other sections. Lab, path, and medicine are some of the most difficult sections. You could spend more time in cardiology or integumentary, any other urology, female organs. You could spend your time stressing over those sections and getting those to where you could score 100% in those sections, which will bring up your lab and path. You could spend a lot of time here and try to bring this up, but the quality of time and bringing up real scores could be better served in other sections than in lab and path because it is so difficult to understand and get those questions correct during the CPC exam. As far as I know right now, because everything that I'm teaching, no matter what I teach, this section still scores low. And if you get a 50% in this section on that quiz, which is 10 questions for this section, then I think you're doing great. That's wonderful. Really good. I had a mentee, Jess, if she's on here, she scored 100% on 6 of these sections after spending a couple of months with me. And that brought up all the sections that she might have been low in, like lab, path, and medicine. So she passed with flying colors. No issues there. So stress over lab and path, but don't overstress on it. Save your overstressing for some of these other sections. Modifier 91 is super important in this lab section. If you have a patient in the ER or admitted in the hospital and you're redrawing labs within hours of each other before 24 hours is up, you're doing glucose tolerance test, or you're doing blood gases or kidney functions of any sort that are less than 24 hours, and you need to repeat the same test, hourly, then you need to know that modifier is going to be super important on those answers. You do not use modifier 51 or 52 in this whole section, so make sure you make notes of that kind of stuff. Our CLIA waiver modifier is QW, super important there. And some things that I like to write, MYO means muscle, but MYCO means the study of fungus. So that's why I have that there, is because you're so used to MY being muscle. I added that there. Be sure that you know a specimen is a tissue cut into blocks, that a block is a frozen piece of a specimen, and that a section is a slice of a frozen block. That'll not only help you here, but it'll help you in integumentary when you're in that section. Some of these tests are bundled, which are these. And what I've done in the first part is I've added up how many tests are in each bundle so that I can add during the middle of my CPC exam, just in case. Some of them take certain bundles that have like 3 or 4 tests in each one, and then you got to add them separately and then add them together. But I just like to audit. So I audit a lot of things, how many are in each thing. You could run into some CPC questions that will take one of these bundles and say, which CPT codes is the unbundled equivalent of a basic metabolic panel? And then you'll need to be able to list all those CPT codes. The nice thing is they're all listed here beside the bundles. But I think they were using the lipid panel recently on one of their practice exams. And it's just which one of these examples is an example of an unbundling. So it ended up being the lipid panel with those 3 CPT codes. Now it doesn't say lipid panel, it just lists the 3 CPT codes. And then another answer will list 3 other CPT codes. So you need to be able to recognize just by the individual codes that, oh, that's a lipid. It was just a bundle that had 3, so I don't foresee them going into something that would be much bigger. Maybe the hepatic panel here that has 4 CPT codes. Just know those 2. I don't think they're going to list out 10 CPTs and say what's that a bundle of or not a bundle of, but I'd pay attention to those 2. A lot of the CPC exam in Lab and Path is not what test you're doing, but how the results are presented or how the test is done. Meaning, like, is it a visual exam and that's your test? You know, when you dip a dipstick into something and somebody visually looks at it with their eyeballs and that's the test result? Or is it analyzed by a computer or an essay? Or, hold on one second. I'm going to yell at a kid again. You just have to do what I say to get what you want.
You literally bought that pizza for me to eat.
Lord, He's challenging me today. Give me strength. Please, Lord. It is easy to make, I said this the other day, it is easy to make good kids, but it is really difficult to make good adults. And he's going to be 13 in 2 weeks, so no, he's going to be 13 on Monday. Oh my gosh. So challenging. So challenging. Sorry about that, guys. Let me check out chat and see what all I've missed before we rock it on. She took it Saturday. She had exam B, and there was a lot of notes that were helpful. Yep, it's a struggle waiting for my results. I know it is. It really is. The online exam, unless you take it on the weekend, it's like pops up the next morning. So if you take it on Monday, the results are on there on Tuesday morning. So we've had one recently that took one over the weekend, like Saturday and Sunday. Wasn't ready till Tuesday morning. So they get a little influx right now. So even the paper exams where they go to do the Scantrons and they mail it somewhere, the mail is slow. Number one this time of year. Super slow because they're so inundated. If you've ever been to a post office recently, the line is out the door anytime, Monday through Friday, it's just out the door. And then also the workers at AAPC at headquarters have to scan and enter all that stuff manually, and they're getting a big influx. So it's taking a little bit longer on all those things. So yay, Kimberly, thank you for saying it was helpful. Jen, I need to schedule tutoring session with you before the 20th if you have time. I do. You go have at it, Miss Mermaid. You should be able, Lisa, you should be able to go schedule that right away. Can you go over hit picks in the book? And I need to take mine on February. Yes, I can. Go over hit picks. Me too. I need to schedule tutoring before the 29th. Okay, Lily, no problem. You should be able to schedule those. I have Saturdays, I think, open, and Tuesdays open. I took Thursdays down because I go to physical therapy, and it's an hour drive and an hour back. And I just can't figure out how to make the thing to say, okay, on this day, I only want to do between, I don't know, 2 or 3, but I don't want to do, all day. So anyway, I'm still trying to figure out the website, but I will have some more Thursdays open up as soon as I'm finished with physical therapy. And I should have Sundays open too on the schedule. So all day Saturdays and Sundays, Tuesdays all day, and I'll be putting Thursdays back up soon as soon as I finish. I got to go do physical therapy this Thursday, and I think that might be my last one. We'll see. Look how much movement I got in my fingers, y'all. Some of y'all that may have been following me, I injured these fingers in July, so even in October, they were straight as a board. I couldn't bend those joints at all. I had lost function in all those joints. But look at that. 2 sessions of physical therapy, and I just can't close it like that yet. But I'm getting there. I'm getting there. That's really good out of just 2 sessions. So it's a pain. It's a pain. It hurts. So was talking about these being bundled, was talking about how they might ask you which one of these sets of CPT codes is an unbundled package, and paid close attention to your lipid panel and your liver right there, your hepatic. Now, a lot of AAPC's tests are not what you're drawing, but how the test is presented. So some tests are definitive, which means like a positive or negative for this drug. Then some of them are therapeutic, which is what level of this drug is in the body. And also with that, they also can use verbiage like qualitative and quantitative. We're on page 586 if you have the CPT for 2021. Be sure you know qualitative is the presence of, which is positive or negative, and quantitative is how much, therapeutic level. So be sure you know that kind of information because they'll change up their wording for sure. If you don't do any other section, be sure to go into your lab and path, find all your red codes that say that this code is out of sequence. They'll give you a range of codes of where to go look for it instead of putting down the page number for you. Go on and write the page number. If they're on the same page, I just put an arrow to where it is and then put a page number down. Next year for 2022, I'm going to put the page number and then what column it is, column 1 or 2. And plus it's all going to be typed, so you don't have to read my handwriting like you had to do this year. But there's nothing worse than getting to these codes and then you can't find them because they're out of sequence. You only have 120 seconds per question, and that time goes really, really fast. If you're doing the exam in person, that includes the time just to break open the seal and get into the exam. You're already losing time per question. It's just insane how fast this test is. You look down and then look up and 6 hours is gone and you still have 40 questions to answer. So it's pretty intense. Even nurses, the NCLEX exam is only 75 questions long. We have 150 questions. It's ridiculous. We got too many. So another way that they do these tests back here is what chemicals or process do they use to create a result. You need to know that there's a difference. Some of them are amino acid, some of them are multi-step, some of them are enzymes, and some of them are single step. So they separate all those codes out into different categories and areas. I'm going to show you here. There's different chemistries too, because they use urine, blood. They can even use your breath, sputum, feces. There's a lot of different routes to get the med or lab test result on a particular thing that they want. There's many ways. Just the fecal occult thing can be a single card, 3 cards. It can be where it's a shake-up tube that they put the fecal matter in with the chemicals. They have all kinds of ways to do that now, and you need to make sure you're under the correct heading, the correct style and type of lab processes and techniques before you even pick the correct CPT code, because if you're in the wrong thing, you're way in the wrong thing. I've written out the OB panel. It used to be on the CPC exam. I've not seen or heard about it being on there recently at all since March of last year, maybe April of last year, but that OB panel isn't specifically around here, but you make it up with these CPT codes, the 80055, then you do the CPC, which is the 85025. Then you have to do a blood count, which is another CP, and then the main white blood cells, it's different, and then include your HIV. So it's a whole panel, but they don't have it like listed as an OB panel. You have to take a little from here and a little from there. But I haven't seen or heard anybody say anything about that being on recently. But that's one of the things that I have listed in my notes. If it's a single step process, I list it out. Like this code is 86318. And then some of them are totals or ratios or just a count of certain items and things. And knowing the differences will definitely help on some of these codes. Everything on this page, and I'm on 654, is a multi-step test, which is key for the CPC exam. Also having your AKAs listed, like knowing that this CANDIDA means it's a yeast, looking for yeast, because they might say that in the test question, but they won't say the candida. Knowing that the Epstein-Barr virus is also your AKA herpes virus or AKA mono, because they may just say, let's do the mono test on this patient. There's 3 different types too. You need to know which different type is the one that they're going to want to draw. These are all multi-step tests too on 655. Another AKA is on page 656. We're looking at 86812. This is a human leukocyte antigen. You need to be sure and know what your abbreviations for HLA mean. When we get into microbiology and some of the other things, they get real interesting, guys. Starting on page 661, all the red, and I don't know if y'all can see the color, but all of these codes, not the top section, but this bottom part of that first column, and then all of the second column, all the way to the next page, are all enzyme technique. Some of these tests will be repeated in another part of the section where they're nucleic acid test, and if you don't know under which heading, because there is no heading, wouldn't it be nice if they had enzyme technique, and then all these were under that heading, and then had another one where these over here in the blue mean that I put in the blue that are nucleic acid technique, but there's no headings or separations of any sort to let you know that there's a difference. So, and then the first 5 codes in the top section on 662 are part of the enzyme technique. Then you skip 3 codes and then starts the nucleic acid technique. So you can see why I say spending a lot of time on this section, it's already really difficult. There's no headers, there's no clear descriptions of these codes. You'd need to look at the CPT assistant per year or month underneath these codes that they list out current descriptions to get full rationale of what's going on a lot of these codes. But I'm on 664, and all of these are all nucleic acid techniques. Then you get down here to 665, and just half of the first column is part nucleic acid technique. Then you back again to single step test. Then you're back again without a header to multi-step test for most of the next column. If you don't know what you're under, then you could pick the wrong exam test question answer. On 666, we have our crime scene investigation, autopsy, or if it was an accident, autopsy, being able to tell those differences. Those were on my CPC exam. All the pink highlighted codes were on my exam. And then you get across here to the pap smears. They can do the brush and slide and spray fixative kind, or the thin prep where they're swashing inside of a tube of solution. But you need to know all the differences in the different types of stuff that are used. How do you know it's a nucleic acid technique? What page are you on? I'm sorry, guys. The nucleic acid techniques start with 87471 and go all the way to 87662. And how you know is either word of mouth or learning your guidelines that are in between these sections, but they're not near the sections where it starts. The way they've arranged lab and path and microbiology, they may talk about it and tell you some guidelines and say certain things will start at a certain code in these particular areas. Right here, they're still talking about a definitive identification, which your definitive tests are way back here, where we were talking about definitive exams way back here. It's infuriating. Knowing what every single word means in all these guidelines before you start coding is where you can start decoding some of this information. But also, you need to have the CPT insider's view from the year that they published per CPT code, and there are multiple years. Every year they publish an insider view, and it does not cover every CPT code. But what it does cover is a few that they've changed or updated or decided to discuss that year, and this is how you find out the pertinent information. I'll show you one real quick. Did you look underneath the Christmas tree for your tablet to see if it came out of that crack and slid underneath some of those packages or something? Did you put away the clothes that I have sitting here? They're clean for you. Did you make sure you got out all your washcloths out of that bathroom tub, or do you get slathered with them? And you didn't use a washcloth, so you didn't have to put one up. Right here. So if you take, like I have right here in front of me, 2020 Insider View, and if you go to a particular CPT code of any sort, they will give you rationale on how to code it. They will also give you clinical examples, and look at this description. It'll go on for the next page too. Some of these descriptions for these CPT codes are like crazy because we're used to getting just a few little words, but some of these descriptions of the CPT code are pages long that really go into depth about what's going on with this procedure and how you're supposed to code it. It'll give you clinical examples, descriptions of the procedure, and how you would use it. But the problem is that they publish one of these every year, and then they might only do 10 lab codes per year. So to be able to get all the information you need, some of these are back from 01, from 2001. You got to go have a whole library full of these things to get all the information that you need. So it's not fun. It's not fun at all. All right, we did crime scene. We did pap smears. If something could be a technical component, I wrote that down. That's a whole nother issue of things. If some codes can't be word searched out of the question, they have to be word searched in the results of the labs. You have to do the process of elimination a little differently, or you cannot use them for these levels 1, 2, 3, 4, 5, and 6 codes. There is no process of elimination as far as the numerical number is, but that's just 5 codes. The rest of the codes in the entire book you can do process of elimination on. It's just really good that if you do have a practice exams questions or any exam questions you find on Quizlets, verify that they are truly correct first, though. Don't just take word of mouth. But if you are doing any courses or if you have any of the study guides, even previous years is just fine from AAPC that do have questions and answers in them with, of course, the rationale. And you know this is a correct code or a correct rationale for it, then write the examples here in your CPT book. I like to have 2 per page of examples, 3 if you can fit them in, just how to code each one, what kind of scenario would be going on is super helpful. That way you have a reference book to go along with your CPC exam, especially if you paid for a course and you're doing those chapter exam reviews, you're doing the chapter quick exams. All that stuff is super helpful to get into the book, especially in Lab and Path, obviously. But I have some Lab and Path questions we can go over and work on for sure. And I wanted to go over the new information that was on people's exams this weekend. For sure. For sure. Let me see what's going on with that. My kids are still super loud. All right, I'm going to check chat real quick. Trying. Am I still there? Okay, good. What page? Okay. How do you know if it's nucleic acid? Good question. They do not intend us to pay. They do not intend on this passing, do they? No, they do not intend on y'all to pass. Nope. Why? They could get the retake fees. They can get your boot camp fees. They can get your membership fees for 3 years while you're trying to pass this exam. I've audited this exam, and I guarantee if you truly give in to my process of elimination, if you stop reading your exam questions, and I know that sounds crazy insane, and you do this process of elimination, I can get you to a 70. I can get you to a pass. And that's the goal, is to get y'all past this. You don't need to learn a career's worth of coding to pass this exam, and even a career's worth of coding will not do you any good to pass this exam. The exam is not coding. The answers are already there for you. You just need to learn how to pick the correct answer fast, and I can show you a process that will get you that way, but you have to let go of being a coder to do this, and it's super hard. Plus the sharing of what anatomy and things that are on the CPC exam that I've been collecting from the people that I've been mentoring is super helpful. I mean, just to know what definitions are coming up is just, a breath of fresh air in the middle of a stressful exam when you see, oh, I know 3 parts of the knee. Jen told me to watch for that. I've got the notes written here. Turn to that page. Yep. Verify and move on. So that's been super helpful for a lot of people. I give in. You better, Kim. I'm not playing. It's the way to go. I promise. I'm not going to steer you wrong. I really want to be truly helpful out there and not tell you just to keep coding, keep practicing, keep doing that. No, you need to let go of being a coder. You're going to learn how to code when you get a job, which is going to change dramatically. Nothing that they teach you in the courses is going to prepare you for walking in that door, except for knowing some of the vocabulary. What is a CPT code and what is an ICD-10, all that other stuff you're going to have to learn on the job. It's going to be fun because they've already got the process and policies and procedures in place. Plus, they code differently based on their contracts with their partners. So even their lab departments are partners, their radiology and all that stuff, they code based off their contracts. So group numbers, even if you have Blue Cross Blue Shield, it's not going to be billed or coded until you get down to the group or individual employer level. It's crazy how many contracts are out there that you have to code in a certain way, and they'll teach you all that on the job. So don't worry. All multiple choice. Yep, every bit of it is all multiple choice. And I'm going to go over real quick what was on everybody's exam recently. If you want the complete list of what was on it for the last 45 days, it's in Etsy. But, and as I update it, if you do purchase it, as the weeks progress and move on, I'll continue to send you updates of the new stuff that I've added, all free. So be sure you know what the definition of medical necessity is. I have it right here. That's from last week. And our group home, which is the service code. Be sure you know what a service code is and where to locate that. Hint, it's the very first page in your CPT book. So for December 5th update, instead of 3 bones of the shoulder and knee, now it's the humerus. So be sure you know the 3 bones of your humerus, which is the shaft, and your proximal point and your distal point. So that will also help you when you're coding fractures. You're going to need to know that there could be different CPT codes for all 3 of those points if the fracture is located in one of those areas. We know there's a distal end and a proximal end to the humerus and tibia bones and the femoral bone, so be sure you know all the differences there. There was a code or a question about what's the difference between CPT codes 34715 and 34716. 34715. You should make notes of this in your CPT book if you haven't already. That code is for the delivery of an endovascular prosthesis. Now the 16, they create a conduit for delivery of that endovascular prosthesis. So be sure you know the differences in those 2 CPT codes. There were questions about an open right compound fracture. Be sure you're going to need to know the difference between the fracture being open and closed. Don't forget you might need that modifier, RT, and compound. Do you know what a compound fracture is? Do you know what that means? Especially when you're looking in the CPT codes. So be sure and look up some of those definitions in case you don't. The HIPICS code G0009 is for the administration of pneumococcal vaccine for Medicare patients. So be sure you know that one. They don't use CPT codes. So anytime you see Medicare, you need to know that you're going to be in that HIPICS book picking out something for that patient. There was tubal pregnancies. Ooh, I got it written down twice. Got an echo and spelt wrong. Be sure, all these copies and paste. Copy, paste, copy, paste. Be sure you know the difference between tubal pregnancy and molar pregnancy. Okay, one of them's outside the uterus. One of them is technically in the placenta. So be sure you know the differences in those. The removal of a foreign body in the 3rd metatarsal joint. What, my love?
Some chicken.
What did you eat at the basketball game, baby? Because I gave you $5 to eat pizza.
Oh,
and
I got
water.
Gatorade pizza, Takis, Starburns. So
Then you can wait just a second till I get in there to fix your plate, okay? Unless Grandma wants to fix you a plate of chicken.
oh my gosh.
Okay? Oh my gosh. Literally just ate 20 minutes ago. Service code is the same as place of service. Yes, it is. Good question. That's why I was like, they describe things in a lot of different ways. The AKAs are super important for your CPC exam. I'll go over the process of elimination in just a second. So they've been asking a lot of questions about this particular definition. This particular weekend, they asked what area is being worked on when you're talking about this area. Do y'all know? On CPT code 97112, this was a therapeutic procedure to help patients sitting and standing. It was one of the back codes. Yep, ears. You've got your ears. For the my ring, I always think about the ring as like you can hear your ears ring. My ears ring when I go to bed at night. It's like my house is so loud. My kids are, they're 13 and 12. It's like, and the TVs, we have 3 TVs on our wall in the living room, literally, because one of them has Twitch, one of them has YouTube going, and the other one has whatever Netflix or Prime has going, and they're all right on top of each other. It's a menagerie of just boyness going on constantly. And then I make them keep all their electronics in the living room so I can watch them for whatever they're doing. And so we have computers and their switchies and all that stuff. It's just a loud house. Very, very loud. So my ears ring when I go to bed at night. Okay, what was I talking about? This 97112 therapeutic procedure for the neuromuscular reduction in movement and balance and coordination. They trying to help patients sitting and standing. So know some things back there in the medicine section. That CPT code came up this weekend. Boys, oh my gosh. No, I do not need a girl. One hormonal female in this house is enough. I promise you. I already live here with my mom. She has a casita, her own house, but still, no. I am hormonal enough. Oh my gosh, and my Travis is just so hormonal. My 13-year-old, yeah, he will be Monday anyway. He is just like a female. Oh, James is easy. He's like lazy, easy boy. He just wants to be fed and play his games, and he'll leave me alone. He's easy. Travis is just a spitfire. Oh my gosh, what now, Travis?
For you, did you not want the package?
No, I don't want the package. Not in the middle of my life. Amazon is going to be bringing tons of stuff. Just let it pile up. He's back in here again as I speak of him. But I really honestly just wanted boys, and I, thank God, got boys for sure. Good gracious. My mom just sits back and laughs at me. I'm her only kid, and I was the daughter, and she says I was total terror, but she just is getting a kick out of watching me having to deal with all three of these boys. But I just think that's horrifying. I don't know. Are girls easier? I mean, with boys, you just spray them off when they start stinking and they don't really care what they wear. And, I couldn't imagine having to worry about hair and makeup and nails and clothes and then mean girls. And it just sounds horrifying. Are they easier? Maybe they're easier on their mamas, but then boys really love their mamas. Now, if I was to break down and break a tear out, I'd have all of them cleaning the house for me. So they're pretty easy. I could remember not caring as a kid what mom went through because I was a girl and I was like, I got my own stuff to deal with. I don't know. Thanks for the likes. That's funny. Okay, I get to rattling on. Girls scare me. Okay, labyrinthitis, whatever the heck that is, it's an inflammation of the inner ear. LAB. So we've got my ring. And then if you've got an inflammation of part of your ear, it starts with a lab. So those definitions will definitely help you. Kim's going true. Oh, gosh. Boys think they're sneaky, too, and they just keep trying to be sneaky, and they ain't sneaky at all. They ain't got nothing on girls. Girls can get sneaky. I know, yeah. Oof, for sure. It probably does depend on the kiddo. Travis is getting me back for all my misgivings to my mama I ever did, for sure. The metastase, whatever is in the central compartment of the thoracic cavity. Be sure you know that. We've got an ambulance service for our hip picks, A0427. It's a level 1. Be sure you know when time starts for anesthesia and when it stops. They're going to ask you that question. It's always on there. This one is kind of cool. Somebody said that the wrist joint is distal to the elbow joint, and that's one of the questions that was on the CPC exam 2 weeks ago. And I added some extra things in there just in case they asked about these, but that the eye is lateral to your nose is medial to your ears, the brachial artery is medial to the bicep tendons. This all seems like way too much to learn, and it really is. Just make sure you have something written down. In the musculoskeletal system, The one that they were picking on was the wrist joint is distal to the elbow, and then the knee joint was proximal to the ankle joint. Those were the two that they were picking on recently. But I do have some extra ones up here in case you wanted to know them. Another Category 2 code was our 0102T. It's 25 minutes of shock therapy under anesthesia that gets function back in your elbow or helps reduce pain. So be sure you know that. And then now I've got some process of elimination. I just need to move my books around a minute so that I can help y'all look up in the CPT codes where we're at. Don't be reading that question. We're not going to be reading questions, right? Remember, my process of elimination is to help you get through 150 questions, less than 2 minutes each. So that if you have some questions, 5 or 6 that you have no idea where to find the information, and you're going to need some extra time to look up the answers. Remember where it is in the book to find the answers. You're going to need to bank some time for those. You can spend easy 5 minutes on one question just looking for information if you need to. It's going to happen. My one advice is if you start the exam, it doesn't matter. In the front of the book, the back of the book, in the middle of the book, the first question on the online exam or the last question on the online exam, whatever you start with, if that first question just makes you deer in a headlight and you have absolutely no idea where to find that information because no one ever said anything about that particular CPT code section or described a type of question like that before ever in front of you, don't worry about it. Go, oh, there's my deer in headlights that Jen told me about. I'm just going to skip this one and move on. Just skip it. If you want to pick C, you can write it down somewhere. Say, I'll go back to it later and think about it later. If you don't want to think about it later, just pick C and move on. Anything. Don't stay there. Don't let the first question shock and awe you and make you think that you can't do this. It's there for a reason. It's to do that to you, and don't let them trick you. Just keep going. Even if it takes you 3 questions in to finally find one that you recognize and you go, oh, okay, here it is. That's where you start. Just start from there and keep going. Keep your groove up. You can go back to the other ones when you get time. They're all weighted the same, so it doesn't matter if it's 1,000 words long or 2 words long. It doesn't matter. They're all weighted the same. So don't be scared of your big ones. I love the big questions, and I'll show you why in a minute in some of my examples. They're some of the easiest ones to do, and especially with the process of elimination. Some of my notes here, I'm staring at this looking, oh, they should know this. A lot of things, if you pay attention to some of your practice questions, some of your practice questions will have information in it about a CPT code that you didn't know. You might know that this is the correct answer. The way they worded the question is, like a 58-year-old man who had a humeral fracture, who had to have some crap done to it, and they did that external fixation, with the wires stuck through and all that crap. Well, if you didn't know some of that, because they call these like the Kirshner wires, or that it's a closed procedure, once you do find out that's the right answer, then go write that information next to the CPT code. Also, some of these CPT codes will have the name of the procedure or the instrument used in the CPT code. So, like some doctor invented some sort of cool contraption that he's super proud of, or she is super proud of, and they named the instrument their name, last name. Sometimes it's combined, like it's a Walsh Kushner technique or something. Pay close attention to those names because, AAPC has a history of using the proper name in the test question. And sometimes the proper name isn't in the CPT description, but it's in the parenthetical notes, which are right underneath. Like it'll say the Myers way of doing it or something. I don't have an example right in front of me. We'll find one in one of my practice exam questions in a minute, but I love it when they give me a proper name of an instrument being used or a proper name of a particular procedure being done. You know, they call this one, I'm on page 170, the 24577 is called an ORIF. Even though it doesn't say anything here about ORIF, the CPC exam question is definitely going to say that, and that's practically all they're going to give you. It's an open reduction of a fracture right here, but it's the abbreviations for it, and that's what that CPT code. So if you pay attention to some of your questions, they're going to give you extra information that you need when you find out that that's the right answer. Plus, don't forget about your parenthetical notes down here, especially if they name a particular thing. Like this one right here says the Montega type. That's named after somebody. They'll definitely use that name in the CPC question. And if it's a difference between, this is an open fracture of a dislocation elbow. So there's two of them that are labeled the same. So what is our difference? This one's with manipulation, and this one's the dislocation. They're going to use that, and it'll be in the top of the question where it says what type of procedure they're doing or what type of fracture it was. So the Montego fracture, whatever it is. Those are super helpful. I love it when they're trying to decide because that helps me narrow down what the right answer is. Anyway, rattled on enough. Let's see. I'm sorry about my squeaky thing. I need to get some WD-40. All right, for process of elimination to work, what you need to do is forget about coding for a second, and you are just going to look at these numbers like you are a mathematician of some sort, that you're a math wizard, a number wizard, and you're going to look at these numerically and see which are the similar or so close together, just numerically. We don't care what else is going on. I don't care about the modifiers or nothing else. But because I've got 72149 and then 72148, those are only one numerical number apart, I'm going to get rid of D. I'm not going to care about that one, and I'm not going to care about A. So now I've busted this question apart without even reading it, and now I'm down to a 50-50 shot because AAPC has a pattern. It's not 100%. It's in the high 90s percentile where they will give you a question like this, where they give you two throwaways and then two that are super similar. And then all you have to do is go look at the CPT codes, figure out the difference. Before you read the question, you are going to go to those two CPT codes. You're going to pick the word difference that is the difference between these two codes that will change your answer. And you're going to go do a word search through the question from the last word up to see which one of these they did. You're not going to read those questions. So let's go to 72148. I like to go to the first one numerically in sequence so that I know the other one is right after it. But you can do anything you want. Also, when you're flipping through this book, keep your eyes up here instead of scanning the two columns, looking for your codes, because this will keep you moving faster because you're looking for 72148. I ain't there yet. 72148, yep, and 49. There we go. It's these two. So one's without contrast and one's with. That's all I need to know. I don't need to know nothing else. Out of this exam, this question. I don't care who the patient is, why they're being seen. All I want to know is if they're using contrast or not. Contrast is usually a dye or a reagent, something that makes the thing flare up, right? So we're just going to go look from the last word back, and we're going to look to see if they used any kind of contrast. Look, contrast word. So we are using contrast, so I know my answer is 49. We're picking 49, and we're done with that question and moving on to the next one. If you can't do these questions within 30 to 60 seconds, then that's what you're supposed to be doing, is what you're supposed to be doing. And they expect you to do this by reading all that crap and then going to look up all those codes. If you do it the conventional way, like human nature tells you to do, you're also going to be banking all those words, everything here that you just read, and then trying to remember all those CPT code descriptions from all those different answers that are possible, and you're going to carry that number one question with you with all those words to the next question. All you remember if you do it my way is with contrast or without. You got 4 words with you when you move on to your next question. Brain fatigue is going to hit you at question 100. The last 50 questions is, if you go through here and you read word for word what's in each scenario, it's going to kill you, and you won't be able to function the last 40 questions. You're going to give up, and you're just going to start bubbling in stuff. Plus, you'll be out of time. You'll have like 10 minutes left, 20 minutes left, and you won't even be able to read the last 40 questions. That's the way you need to do these questions, and these questions do come from AAPC. I do pay for them and get them, and yeah, we need to do them that way for sure. All right, I'm going to check. Come on. Don't forget to add any clinical examples that you can to these pages. And, okay, let's do that again. I blinked. You got it, Kim. You got it. Thank you. I have an exam on the 16th. It says without contrast. Yeah, you're right. Without contrast. But it's still fun to do. It's still fun to do that way. But it is without contrast. You're right. Let's go right here to this one. We've got this one and this one. D and C are super similar. We might want to consider the 11th because a lot of times the odd numbers are right below each other. The 11 might be right next to the 15th. But, you know, we're definitely going to get rid of A for sure on this one. And then we'll go to I like the 15 and the 16 just because they're so close. So 7, 6, 8, 15. 7, 6, 8, 15. 7, 6, 8, 15. 7, 6, 7, 6, 8. 7, 6, 8, 15. My pizza page. Yeah, no, 11's pretty far away. 15 and 16 are right up underneath each other. They're super close. This one's a quick look, and this is a follow-up due to something else. They wanted to check measurements and growth. This one's just a quick look to see position. So let's go see what our question says. Pregnant woman, and we're just doing fetal position, right? So we are definitely just doing a quick look. Anytime they use that particular description as far as just position, they are definitely doing a quick look. And that's just one. You really, and you know, 16, it doesn't have the plus in front of it. You know, some of these codes have the plus in front of it, and that's where you can do the times 2. But this one, you don't do times 2 to that. I mean, I don't know. It does say per fetus. I guess you could. Could you? Per fetus? It just looks really strange to me. Most of the time, these are the ones that you do because it says each. Each is a descriptor where you can do times 2. The 16 isn't that way. But anyway, D is your correct answer. The 11 is way over there under pregnancy, ultrasound, but it's to determine the anatomical examination. It's where they do all the measurements and things that they need to do. And then the 12 can go along with it if there was each additional gestation. So if they had twins and they were doing measurements, that's the one you would use. But we just have this one. We are just looking up our fetal position, even though it's twins. If you note, your 15 says 1 or more fetuses, and it's just a quick look for position. So you could have 6 babies in there. They're just doing a quick look, okay? D is our answer. We've got our lab here. Lab area coming up. We've got lots of codes. We've got some of these codes are 1, 2, 3, 4 deep, and one of them's 3 and one of them's 2 deep. What do you note right away about some of these, since they all start out the same? What modifier did I tell you in the beginning of our live that we are going to be able to use for this section? Especially if you're doing the same CPT code multiple times within a certain session, like before 24 hours is up. Yep, you got it. So when you're looking at this, there's only 2 that have the 91. The 76 and the times 3 and the times 4, D wouldn't happen without the 91, right? And neither would A. So we definitely can look at these and eliminate it down to just the 2. So now we can figure out from here, we got a 50-50 shot. What are we drawing? What are we doing here? Let's go up here. So we're doing CPK enzyme levels because of the EKG. And it's going to include the isoms. So we've got 2 that we're going to be repeating. Let's go look up our 82550 and see what's going on with that code. And the next one, 825. Lord help. Let's hope it's not out of sequence. Let's see. 82550. There we go. We got the creatinine. And what is the 2 has the thingy, the other thing that they were looking for. How many times did we order which one? I need to look up the numbers. So we did 3 of the CKD enzymes with instructions to test with that one. Initial test was elevated. So we did each of them by 3, right? Each of them by 3, and we are at 225. So, if you did this one 3 times, the 82550, which is your creatinine, you would have to code that Then you code it again with your 91 modifier and do times 2. Then if you needed to do this code, the 82552, you do it once. You draw it again. You need to add it again with the 91 modifier, notifying the health plan, yep, I'm drawing it again, the same 24-hour period, times 2 times. So I need to look for things like that. It's twice with the times 2. It's twice with the 91 times 2. That's the scenario of how you draw the repeat labs in the same setting on the same day multiple times. Good example to write in your CPT book, which I don't have anything written on this page, but that's a really good one to write on this page. Is C is our answer for this one. You can just write a small scenario about EKG abnormal. Then you can say MD ordered 3 serial CPK enzymes. Ooh, that's hard. Times 3. And then, well, I already said 3. And then 3 isoenzymes. And then this is your answer. Be sure and write it in the sequence the way it is on the CPC question right there, so that you know if you have another example during your exam, you've got it coded correctly. Yep. Only modifier 91. Yep. If we go up here to my notes in the beginning of lab, it's, you know, probably not the only code you use in this section, but it's the big dog. It's the one for the repeat labs for this section, for repeating glucoses or blood gases or those kinds of things. Anything that modifier is for repeat labs on the same day, that is your modifier for that. And we do not use modifiers 51 and 52 in this section at all. So that's your big dog modifier. That's the one this section utilizes the most of. And I like to write our main popular ones in here. If you read some of these guidelines and notes, it'll tell you what not to use and what to use for sure. All these little sections before each exam or each separate section of CPT codes, it'll tell you the same thing I told you for sure. But C is our answer for that one. Okay. This one, we've got 2 different ones. We've got the 58, 58, and then the 30 and the 30. Or you can go through the modifiers and see, based off just the modifiers, since they're all separate, which one would be the right answer. And it'd take just as much time to separate out the 2 CPT codes, decide which one we were at, as it will to go through the modifiers. So I always just start at the top. 79 is unrelated procedure. And then 58 is a staged procedure. Unrelated procedure done by the same physician or other qualified person. So we'll just check this question. We'll go backwards and see what's going on with this patient. Looks like she's having she had sedation. She's put Sabine. And I do see right here the first stage. Right here. So it looks like she's having something done in stages, right? Why would they use that code if she isn't? So I'm really liking that 58. Let's look up what 76 is. 76 is a repeat. No. And then 78 is unplanned. Is she going back unplanned? No. And reconstruction, the first stage, margins were blood, and now she's doing a second stage. Love it. They're actually saying first and second, so yep, love it. I love B. We're going to pick B and move on, and oh my God, my child is here again.
No.
What?
Alexa,
What?
Grandma fixed me some chicken. I ate dinner. James is just sitting on the couch. He's not eating dinner, by the way.
Did he find his school-issue tablet?
And can I have some ice cream since Grandma fixed me some chicken and turkey?
Did you actually eat it?
Yeah, I actually ate it. I picked the breast, the bone. I picked the bone. I did. You can't even ask Grandma.
Okay. Good Lord, they can't live without me. But yeah, I love it. B is our answer. Just remember, we're not reading all this stuff. We're just hunting keywords based off what we know will be part of the answer. And I was looking on our front cover here, just as our little cheat sheet, so I don't have to go all the way back to Appendix A and look for those. I like using this front cover of our CPT book. Doesn't have all of them listed, but it's got a short enough description of all of them that helps us. So 58 is super helpful to be used in all that, and we didn't have to read all that, those big old long question, take all those words with us. I'm sorry, phone is going off. Oh yeah, it's trash can day. The boys got to take the trash cans down. I understand. I'll turn the alarm off. All right, tonight is trash night. It's terrible when you miss trash night, you know. Our next one is one of our long ones. It's multiple pages long, so don't get nervous. This won't be hard either. We're going to go right here straight to the answers and do them just like we do everything else. Which two are we keeping? Which two are we throwing away, guys? Don't worry, Shawnee, I got you. This will be easy. Which two are we keeping? Anybody else want to chime in? Y'all like 40 and 43? All right, let's get rid of C and D then. Okay, what's my differences between 40 and 43 then? Y'all go look them up and tell me what the differences are. 44140, and then 43. So they're on separate pages. And 43 is over there. So what's our differences? Can y'all tell what the difference is in these? Can y'all tell? So don't let the CPT codes scare you. This is partial. It's what I would keep up with. Partial. The 43 over here what does it say right there in that parenthetical? It gives you a name. Hartman, right? Love it when they give us a name. Partial and Hartman is what I want you to remember for this one. They're obviously going to close the patient whenever they do anything, so be careful on that closure. But partial and Hartman. So we're going to skim our question all the way up, and if they're going to name a procedure, we're going to go to the top and see if they actually named it anything. What are we doing? We're doing a Hartman procedure. So how easy is that? You know your answer is 43, so you didn't have to read all this nonsense and carry it with you. You just pick B and move on to your next question. Yep, Love it. Give me some more names. Love those. Those are great. Don't let the size of the question scare you. It's not worth the trouble. All right. What are we keeping and what are we getting rid of here? They're all pretty close, aren't they? Let's go see what's going on. Pick the first one as C66982 since they're all super close. Let's go see what's going on. 6666. Ooh, we're in the eyes. 66. 669, 82, 83, 84, and 85. So if you have my notes or I have marked some of these are extra with an E, some of them are intra with an I, and some of them are back to extra, and then this one is an insertion. So extra, intra, or insertion are the key terms that I'm going to look for. So I'm going to look at this question and just skim for those particular words. And usually, like I said, at the top of the procedure, they'll say, so we are doing, you see the extra right there? I'm trying to get my mouse back. There's the extra. So we're doing the extra with the E. So anything that is not an E, I'm going to get rid of. So the 4-3 or the 8-3 and then the 8-5 is insert. So 3 and 5, my oddballs, I'm going to get rid of the odd numbers. So I'm going to get rid of the 5 and the 3. I'm going to keep the 2 and the 4, the even numbers. Now I just need to see what the difference is between the 2 and the 4. And pretty much, come on, word for word, these two CPT descriptions are the same word for word all the way through all that mess until you get down to this 3 word thing right here. And that is the 8-2 uses an expansion device. The 8-4 does not. But they are word for word the same procedure, which is a pain. But if you got my notes, you'll know that this one is the expansion device. So you're just going to look for the key term of expansion device or not. Yep. Usually, too, Shawnee, is the CPT codes are the smaller the procedure, the lower the number. But in this I section, the extra stuff is the very first CPT code. It gets to be a smaller procedure the higher the number, which is very abnormal for CPT. So AAPC knows that. They want you to pick the second one because you're going to think that it's more involved than the first one. That's why they pick this question. Yeah, for sure. They think you're going to assume that it's going to be the second one because it's going to be a bigger procedure because they put that expansion device in it. Yeah, so that's a good tricky one right there. Perfect, perfect, perfect. So knowing the differences, super helpful on some of these when you've gone through and written out certain differences. It can be real helpful. I said I'd go over hit picks real quick. Let me grab that book real quick and let's see. I have a question in hit picks too. And I want to show y'all some information just in case. So if you have the 2021 book, and I got mine from AAPC, I'm not sure if they're all the same or not, but it contains a lot of information, especially modifiers. Your front cover and the inside of these covers contains modifiers for all sorts of procedures, even cardiology, to even the back cover has anesthesia, ambulance modifiers, even more on the inside for all kinds of procedures. So if you see anything with any little weird 2 digits after something, it could be AA to MH to QX, this is where it's all going to be. So during your exam, don't forget about this is where all that little wild stuff is. The other thing I want to show you is just simply writing out what each word is defined as can be super helpful, because one of my questions was this, and they had several different variations, and was it common or was it coding or did they have them flipped? So be sure you know that kind of stuff. This one is updated quarterly, not yearly, so that can be a question. And if you're on the same book that I am, if you go to page 7 and you're in the second column, third sentence down, it tells you what year and what legislation led to it being created, which is the Balanced Budget Refinement Act of 1999. So that's super helpful. I've seen that question on the hit picks. They've been picking out even temporary codes, which I'm shocked about. I don't think they should, but back here in the back, starting around the S codes and probably other places, but these are temporary codes that are put here because they haven't finished yet, and they're still working out all the kinks with them. A lot of insurance companies don't accept these codes, but they're here, and they're under temporary, and they may move from year to year to another section, so keeping up with that information, even though it could be updated quarterly, 4 times a year this book could be updated, these codes can move around some. They've been picking out, what is that, the one with the rental of a glucose monitoring machine was one of the temporary codes back here they were using recently on the CPC exam, so that is back here. Remember, if you're a Medicare patient, they're back here. So Medicare is big in this book. J codes are for your injections. Chemotherapy is in this book too. As far as the particular drug or names of the injections and things are all in here. Some of the common ones that were in my exam are J7324, J7312. Those are your steroids and stuff. We had J7307 and 06, some of your hormone levels. We've got an implant system, so they can implant the birth control or hormones in you. The IUD is in here. The vitamin B12 shot. That sucker burns. If y'all ever had that, that really burns. J3420. Became really anemic one time, and boy, those things hurt. I'd rather take anything else but that. Testosterones are around your J31, 21, and 45. You have to make sure you know your differences in the testosterone. Some of them start with an E word or a U word, but they're still testosterone, so they do have little differences in them to know your differences. Medicare codes are mostly in these G codes. They really love using these G codes for Medicare. It's professional procedure. So if they're doing a colonoscopy, a flex sig, even a wellness exam on your Medicare patients, those codes are all here in the G codes. It's got crazy that they're here. And it'll say it in the CPC question. If it's not stated, just assume you're in CPT. But if it does say Medicare and your answers either have CPT codes in it or they have HitPix code, pick the ones with the HitPix code if you know nothing else. So that'll help you a little bit. We've got these these annual wellness exams for your Medicare patients on 202, the GO439 and the 38. I've seen them use those quite often in some of your guidance and compliance questions. They're using those to make sure you know the difference between those being used or the CPTs. The trimming of the diabetic nails, GO127. Screenings for pap smears. There's quite a few variations here. GO124. I'm on 192 if anybody's looking at it. Thank you for the follow and the hearts and any of those things that pop up for, I don't know what they are, but the little rockets and things that sometimes pop up, we're keeping those funds. So far I've got like $16 in there, and we'll give out free sections of my notes for people that want those or need them for, because I know y'all have spent so much money already with the AAPC stuff. For sure, just trying to get here and pass this exam. I've got also tips to help y'all find jobs. Don't neglect the health plans. Be sure and look up jobs for a CPC under like HealthNet or United Healthcare, Cigna, Blue Cross Blue Shield. Don't forget about those particular areas when you're out hunting for jobs. Let's try another. I got a HitPix question here. So we know we're either going to be J3301 or J330. So I'm going to run those codes real quick. A, B, C, D. I've had people even write out their alphabet on a ruler that they take with them just so they have it, because, you know, it gets distracting. I know they asked me for my name and date of birth, and I went blank on them. So you can go blank on some of the most interesting things. Don't worry about it. It happens. Oh, yay. We got more hearts. This is an injection of Kenalog. These are the same thing. They're both Kenalog. They're both a steroid. One's 1 milligram and one's 10 milligrams. And so the order is for 40 milligrams. So which one would you give out of this based off those two CPT codes? Would you try to give the 1 milligrams times 40 or the 10 milligrams times 4? I really need to get some WD-40 for these. Last squeaky thing. Times 4. You're right. So your answer is A. For sure. Easy peasy. Easy peasy. That one could have been commercial because we don't know if it was, you know, one or the other with this particular one, but HitPix can also be used for commercial. For sure. I'm just checking on the time. Okay. We're good. We're good. We're good. We're good. So let's do, this looks like we could be in E&M or hospital. Something's going on here. Put away this HitPix book real quick. Let's see what we got going on this one. If I can get my books unhooked. Oh, they got attached. So, I really like the 3-3 and the 3, 4, right? If I was doing process of elimination. Those two are super close together. Let's go see. 99233. I gotta make sure. 233 and then 234 are actually under two different headings. We've got on E and M. Okay, one secret to doing E and M is making sure that you are under the right header. There's no header on this page, right? No, yeah, there is. It's over here, subsequent hospital care. So you need to make sure you are under the right header. Now over here on the next code, we're under observation. Before I look at even to make sure you are under the right header. Now over here on the next code, we're under observation. Before I look at even what the code descriptions might say in E&M, I'm always looking for these headers, because if you're not under the right header, you're not going to be anywhere near. The descriptor might not tell you the difference of where you're at. E&M, you have to make sure of your headers, and they might be several pages away, because you'll just have pages and pages of codes on some of these, and your header will be a page and a half back you need to look for. So don't fret about that. If your code's here and you're looking at your descriptor, you're doing something wrong, start off by looking at your header first, because that will save your soul in this section, because there's so many variations. So where was I? 99233. Hold on, let me yell at my kid. Travis, come here. He's distracting me. So 3-3 is subsequent. 3-4 is observation. So with observation during your CPC exam, you want to look for the word wheezing or asthma or allergic reaction. Don't look for the word ER, because everybody's in the ER if they're under observation. They'll trick you and make you pick a code that says they're in the ER. Remember, don't look for the word ER. Kind of find out why they're in the ER and what's going on. If they are in observation, it's usually because they're having an allergic reaction or wheezing. You treat them with their breathing treatment. You make them stick around for a while and make sure it doesn't come back up, or they'll just end up back in the ER again. So observation can be tricky on the CPC exam, but it's not hard if you know what you're looking for. So any question with an E&M codes in it and you see wheezing, check to make sure to see if they're under observation. The doctor may say things like AKA, we're going to observe the patient for 2 hours. We're going to keep the patient here for 3 hours to see. That's observation. Okay, they're admitted in the ER. You've treated them. They're just not free to go yet, because you want to observe them for a while to make sure they're okay. Subsequent, you will be looking for AKAs like yesterday, last night, 2 days ago, things like that. So on this one, let's see what our difference is. They were admitted yesterday. Love it. Yesterday tells me all I need to know, that we are definitely going to be subsequent, right? And we are going to pick C, and we're going to move on to our next question, right? Because these two were outliers. Yep. And yesterday is an AKA for that. And we can move on to our next question. Whoops. There we go. Come on, focus, focus, focus. Sometimes it likes the book more than it does the questions for some reason. Come on. You can scroll down some more. Let's see. What's my battery doing? Okay, good. I got 30%. Sometimes when the battery gets low, it stops focusing too. There we go. All right. So what do we like here? Which two are we going to keep and which two are we going to throw away? What do you think? I got 22 of you in here. Throw me some answers. Yep. Sounds good to me. Definitely going to get rid of the 42. It's way on up there. 21 might be close, but yep. Very good, guys. We'll run to those two codes, or you can run to these two codes. It doesn't matter. Whichever two you wanted to, you could run to, see what your code difference is, and then do a word search. I'm going to leave it up to y'all, and then you look at your test question and you tell me what's going on. And we might have a name, just saying. But there's your, so 42825. I have to look at the first code just because as an auditor I can't skip and do the second code, but y'all can do whatever you please because that's the two differences. Let's see, 42825. 428. 428. 428. 42825. 25 and 26. So all we're worried about is an age on this one. Oh my gosh, that took way too long to look and see if he was 15. So he's 12 or older. All we need to know is that we're going to be definitely doing 26. Yep. That one was so easy. All we had to do was look at the age. That was cool. We didn't have to read none of that information, but we do have a description of a thing, so might have been helpful to know that at some point. Probably for those other codes, the 42104, I wonder. 421. No, it doesn't help us. I wonder, I probably ought to make a note. Like I said before, just because I know the answer to this, I could still take some of this stuff and figure out if this particular mouth gag is only related to one of these codes or not. Like, that's a specialty piece. Then I could add notes to this particular code or the other set that says this is particular to that particular device. It's still interesting how some of these questions can give you information about the CPT codes that you're coding. We know that C is our answer, so this example, even written down at the bottom, would be super helpful during an exam, for sure. Yep. Here we go. All right, which two are we keeping? Which two are we getting rid of? They just make it really blatant. I haven't changed any of the codes, but they certainly make it pretty easy on us. B and C again. And one other trick I want to show you is I'm throwing away A and I'm throwing away D, but D has a code that's in one of my throwaways that's also in only one of my answers. Even though I'm throwing away D, it's here. So that's making me, if I was down to the wire and had nothing else to go on, and I didn't have time to review this question, I would pick C and move on, because a lot of the times they're giving you hints to actually which one is the right answer for some reason. Yep, they're using part of the correct answer in a wrong answer. So I would pick C and move on if I didn't have time to look up the differences between these two codes. So that's another tip. 38500. Let's go check it out real quick. See if I'm correct. 38500. 500. Start doing your practice exams like this, and you'll start seeing patterns like this. So 00 is a biopsy, and 05 is with a needle. The other one is an open superficial procedure. The other one is just using a needle. So I would be looking for the word needle. And just skimming, I see needle in here quite a few times. Yep. So 05 is needle. Thank you, thank you, thank you. I'm glad you like Shell. Hey, Smitty. All right. We're definitely going to get rid of A, and we got to figure out what's going on here. Does this code require a 50? And would it include radiology or not? So let's go to 27096. Let's go see. We're just doing the process of elimination with these practice questions from AAPC. And I'm showing you the technique of not reading the CPC exam questions at all. You're just looking at the numbers numerically. Then you're going to the CPT code descriptions and evaluating the differences from there, and then doing a word search based off the code descriptions, what you normally would see. So we've got some parentheticals in here. So it does say down at the bottom, if it's unilateral procedure, it's that code. For bilateral, you need to add the 50. Love it when they tell us what we're doing with what codes, and if it requires a modifier, I always star those in blue and underline them. And then right here in the code description, it says it does include imaging guidance. So this CPT code already includes imaging guidance. So what can you do now? Even just knowing that, you're going to get rid of anything that's got radiology in it. The only one it could be is C. Even without reading whatever the heck's going on up there, you can't include radiology, so you don't need to do anything with this question other than just evaluating the codes. I hope that was helpful. I guarantee you this one will not be C. I can tell you that much. Let's look at these codes. Which two do you like? And which two do you want to get rid of? So we'll get rid of A, perfect, and we'll get rid of C. Do you note something that's in one of your throwaways, that's in one of your answers? Oops. That might clue you into which one's correct? Yeah. So A has the same code in it as B does, right? But A is one of your throwaways. So that's going to make me lean towards B, right? Before I look it up anything. So if I was in a hurry, I would pick B and move on. But I know that's scary territory. We can go look up 11310. 113. One zero. Over here, and integumentary is just like E&M. You cannot look at the code description first. What you must look at is your header that goes before each code. Shaving. Our other one, the 1140, is under excision. So those are the key terms that I'm going to take with me in the question. Are we doing a shave or an excision? I see the punch biopsy. I see the shaved. So we are definitely doing the B. Yep. No excision, just a shave and a punch biopsy. Yep, shaved and a punch biopsy, which did turn out to be B, which the same scenario was going on where part of the answer was in one of my throwaways. Very weird. I wish I had known this process when I took the exam, because I really, as an auditor, I really wanted to audit and code and really go through the process of making sure I was doing these correctly instead of doing a word search or being a wordsmith here and not reading the questions. Yeah. So this one has a weird B. The E and M would be used for the visit. It makes me want to look up here and see what's going on. So the patient just had steri strips done to their face. Or even if it said they used glue to hold the two sides of the wound together, it was very minor, 0.2 wound. You would do just the appropriate E&M for that. Don't look to doing procedures or looking to do the differences in codes. When you do see something weird and out of place that's not normal, just go on and figure out what's going on. So if they are just doing adhesive strips, steri strips, or glue, you can use a regular E&M visit for that one, for sure. Any questions before I go? I've been on for 2 hours now, and I'm going to go eat some dinner myself. We got some birds my oldest kid picked out. We went through what was recently on some exams. We've got 4 more people that passed the CPC exam for sure. We went through lab. We went through E&M and integumentary and all kinds of sections today. But I really wanted to show y'all some interesting points on lab and path. But like I said, I think your time is better served getting these areas ready more so than lab and path because it is so difficult to do. If you need tutoring before your exam, one-on-one with me, go to Medical Coding by Jen. You can schedule it there. It's $26 an hour, and you and I can work through some problem sections. Just give me some time to prep you some questions ahead of time, like don't book tonight for tonight's session because I need time to prep you some questions. But other than that, just let me know when you book it what sections you want to go over, diagnoses, hit picks, guidelines, whatever you want to go over. I can prep you some stuff for that. Messenger is super helpful. Find me at Jen Brewer on Messenger. Nowhere else, just Jen Brewer. And you can join our Messenger group. It's super helpful, y'all. It really is. We share tons of information. If you want to be the first one to know what was on somebody else's exam that took it today, that's the spot. Because they share. Our group has really been sharing. Some people have been sharing even our practice exams questions that they've purchased from other sites. So if you want a list of exam practice questions, you can even get stuff like that. And of course, I'm sharing all my stuff in there too. So super helpful. I'm very happy this has been good. I will be doing another live Wednesday night, guys. 6:30 Arizona time zone. We don't go forward, don't go back. If this one recorded, I will post it on the YouTube at Coding by Jen. It'll be there. If it didn't, I forgot to hit the screen record. Maybe somebody else recorded it, but I didn't. I forgot to try that particular thing. I meant to try that. But super happy to help, Twinkle. Happy to help. I really appreciate it. And like I said, if anything ends up in this creator fund, guys, I will, oops, I guess that's over here, right? And then we go over, balance. How much do we got now? How much do we got? We got live gifts. That's somewhere. Oh no. Ooh, we're close. We're close to $16. Yay. I've never withdrawn, so if I withdraw, I don't even have a way to do it yet. But I've never withdrawn anything. I don't even have the way to do it. But when we do, I'll give that money away as grant money for anybody that needs sections coming up. But thank y'all for the gifts. That's what I've gotten since April. I think TikTok takes a lot of that stuff, but that's okay. When I get over like so many followers, eventually they're going to have a tip thing here that you can tip and 100% goes directly to whatever. So that's cool. I've seen some people do that. If you need a copy of my notes, you click on this black link right there, the long one, and it will add 20% off to anything that's in the Etsy store. And I have it all on 10% off right now. So that's 30% off. But if you need a bigger coupon, of course, email me at the email address right here or message me on Messenger. And this is where you can message me. Find me, Jen Brewer, same profile pic. And some of my demons are there. But message me on here because I can't add you to our group if you contact me any other place. For some reason, I just can't add people from any other account. And look at our love in our group. If you do a search by the eye icon, once you get into our group, you can search the conversations for particular keywords if you're looking for certain things. You can also do media files, and you can see everything else anybody has shared, like positions of cameras, all my notes, where to move your guidelines, what to mark in your books. I've shared tons of stuff. This is all your compliance and regulatory definitions and words you should write in the beginning of your E&M book before the E&M section. So these are all your compliance definitions. There's just so much that we share, even our pretty terrain, but mostly it's all important stuff. I can't help but share funny stuff from time to time, but most of it's just all CPC related. And then when somebody passes, of course, and then if people need help with questions or they're sharing questions that we can go into. And then if you have one that you're working on, you don't understand why the answer is a certain way, let me know. And I will definitely give you in plain terms why an answer is a certain way. I'm super happy to help any way I can. And I have a ton of tutoring tomorrow. I know I've got some people that's scheduled for tomorrow, so I've got to go prep for those. And then we'll do another live on Wednesday, and then I got physical therapy on Thursday. And then Friday I'll do another live here on TikTok, and then Saturday will be tutoring, and Sunday will be tutoring. So it's open. Y'all please schedule whatever y'all need. I'm happy to help. I know a lot of people are waiting till the end and doing it these next few weeks, and we have had so many pass, y'all. It's been really great to see everybody pass. I haven't even seen that many pass on the AAPC website, but we have definitely had them, so that's makes me want to do this more. So again, if you need a copy of the notes are in the link in the bio. And email me or message me if you have questions, or even leave me a message on TikTok. But I'm way behind on my messages on TikTok. Oh Lord, juggling all this has been fun, but I will slow down on some of this come January because I know people can put off the exam longer starting January. So I'm just trying to help out as much as I can towards the end of the year, but it is getting crazy. Anyway, I really hope I have helped y'all, and I appreciate y'all hanging in for a couple of hours. I'll see y'all on Wednesday. Good night.